This is a short demonstration video to guide you in the use of an oxygen tank. So when the dial goes to 0, it's on empty, it's time to replace your tank. So how to change it? You're going to make sure it says 0, or if you're changing it before it says 0, that's fine too. Take your oxygen level and put it on 0, and then use your key to turn off and seal it by twisting it off. Okay? Then when that is sealed, you are now able to take this and turn it and take off the top. So you untwist it all the way and it slides right out. Now, when you go to replace your tank, there are seals inside of the top that need to be replaced as well, and they just pop right out. And you could put your new seal in there. And having a fresh seal helps prevent leaks while it's in use. So we'll put our seal back on. And then to put it back on, it's important to line up with these two little things that stick out here into the holes of the oxygen tank when you sit it back on. So you slide it back on, line up those two little pegs, and then twist it all the way back on. And make sure it's nice and tight because you don't want any leaks. So then once it's on, you'll take your key and release the oxygen. Just a little, so just enough to hear that air, and you'll see the gauge fill back up then to full. And then you're able to reset your dial to however much flow of oxygen you are supposed to have. And then also make sure that your tubes are connected. It's important that when you turn on the oxygen tank, that you turn it on fully before connecting it then and putting it on your face. So to properly store your oxygen tank, when it's empty, it's important to dispose of it properly. But when it's full, to store your tank, it needs to be in some sort of basin or container that prevents it from falling off or falling out onto the ground. And also to store it, if you can't store it in the basin, then to store it on its side. That way it lays flat. This prevents any dangerous things that could happen if the tank were to fall. This video is not all-encompassing, so if you have any questions, please be sure to ask your physician.